presentation that this SASI procedure, single anastomosis sleeve ileal bypass. You know, SASI procedure is the latest procedure, and since last 3-4 years, it has got promising results. I've done almost more than 200 cases, and I have my paper also, and we are just going to publish that paper in maybe next month. SASI, basically, it is a single anastomosis sleeve ileal bypass. In that procedure, you just initially perform sleeve hysterectomy. Later on, you just bring loop of ileum almost from the iliocecal junction and about 250 to 300, and depending on the weight and BMI, and you anastomose it at the level of the pylorus. So it is a two-way traffic. Half the food is going through the normal passage and the other half is going through the ileum. So it has got excellent results. It has got less malabsorption and maximum hormonal changes. It has great effect on the control of type 2 diabetes, and it is very good in if you are going for redo surgeries. What I have got, like I've got patients, about half the patients, they are done with their sleeve and other procedure, and later on, after a couple of years, they gain their weight, and I offered them SASI procedure, and they did excellent. So these were the procedures, and we are practicing nowadays. As you can see, it is a new metabolic surgery and followed by side-to-side anastomosis. It is effective, safe, and very productive treatment of morbid obesity and associated with metabolic consequences. It's there in minimal post-operative nutritional complication as compared to the other bariatric procedures. You know, these are the links, you know, Mehdi, and there is Dr. Sharma, there is Dr. Saad. In India, they are doing these procedures. And this technique, it leads to early satiety due to the intense stimulation of the distal gut hormones. And there also GLP-1, it has got vital and satietogenic impact. You can see as in this one, and we have done sleeve, and after sleeve, we brought ileum. It depends upon the BMI of the patient, how much you are going to bring loop of intestine. If somebody who have got a BMI of more than 50 or more than 55, 60, then maybe we need to get a distance of about 2 centimeters from cecum. You can see it's the other way around. Normally, when you do a Roux-en-Y gastric bypass or you do a mini gastric bypass, you just count the distance from the DJ, from the ligament of teeth, and from that we count the distance about 200. Obviously, when we are doing for redo procedure, we need to count the whole gut, and about 30 to 40% of the gut we have to anastomose. In this, we count from the cecum. Normally, I go between 300, 250 to 300. I'm sometime who is having a BMI of 35 to 40 but had uncontrolled diabetes, I count around 350. You can see another picture. So this is a way, you know, this one in the orange one, food is going, and in the green one, these juices, they are going. I'll show you the video. And ये वीडियो देखो चल वीडियो देखें जरा जो मेरी प्रेजेंटेशन फिर उधर का तो यूट्यूब में वीडियो देखो ये तो दूसरी नहीं थी वो वाली दिखा दो दूसरी चलो I'll share my video दिखाएंगे ये मेरे लैपटॉप कनेक्ट कर दो। हाँ ये ऑन हो रहा है। चल मैं सही है बताता हूँ आपको। So this is the next slide. I think there's some problem in downloading that video. You can see that loop of ileum, okay, and this is sleeve gastrectomy, and we are anastomosing it to the this one. These are the benefit of SASI procedure. You have got hormonal changes which are maximum and less malabsorption, less hypoglycemia, less dumping. It is easy to reverse, better than SADI and duodenal switch. No gastric remnant is over there. Access to the biliary tree is maintained. Less risk of internal hernias and marginal ulcers. The main objectives were evaluating the role of single anastomosis sleeve ileal bypass in the control of diabetes in morbid obese patients. This is a retrospective multi-center study of almost 200 sample of these cases, and with type 2 morbidity duration was 2 years. All the subjects undergoing SASI procedure were aged between 20 to 60 years with type 2 diabetes. At least 1 year follow-up were included in the study. The patients had previous history of bariatric surgery. Upper laparotomy and psychological instability were excluded from the study. Diabetes complete remission was considered when the HbA1c was less than 6, with no anti-diabetic. Data was collected through questionnaire and statistically analyzed through SPSS 24. So you can see the distribution of patients. 20 to 30 years, 23% percentage, 11.5, 31 to 40, 79 and 39.5, 41 to 50, 87 and 43.1, 51 to 60, total 200 patients. And you can see in this one, 12.5 and this 39.5 and 43.5. HbA1c, you can see this one frequency 6.5 to 7.5. There are 5 patients and the percentage was 2.5, 7.6 to 8.5 to 87 and the 13.5 percentage, and 9.6 to 10.5, 89 patient and percentage 44.5, above 10.5, 20 and 10, total 200, and you can see that. After surgery, diabetes was controlled among almost all of the patients, but among 3 patients, SASI had to be reversed to sleeve gastrectomy to avoid complication because they achieved desirable weight and continued to weight loss. Obesity is believed a significant risk factor for the development of type 2 diabetes, and type 2 diabetes contributes significantly to the overall disease burden. The SASI technique is preferred due to its effectiveness and simplicity, as well as low rate of complication. The finding of our study also indicated that more than half of the patients, 58.5 of the patients, were female and 41.3 were male patients. HbA1c provides mean blood glucose level for the last 2 to 3 months and believed to be most reliable measure of the glucose metabolic control. In our study, major proportional had HbA1c range between 8 and 5 before surgery. So single anastomosis, this sleeve eyelid bypass is a very effective procedure to control obesity and diabetes. Now you can see the transformation of a patient. That he was 145 with uncontrolled diabetes, and now he's 80 kg. He was 160 kg, now 85 kg. That lady, she was from Islamabad. She had weight of 170, and now she's about 80 kg. You can see that young girl, she was 145, and now she's 65. This lady from Islamabad also 160, and now she is about 75 kg. This guy, he was 130 and uncontrolled diabetes. Now sugar is well controlled. She was 160, now 75 kg. This he has remarkable results. Shahid from Faisalabad, and look at him. And now you can see his recent picture. He was having diabetes with HbA1c of 12.5, and now his HbA1c is 5. And he has excellent control of his diabetes. Now in last almost 2.5 years, he has come down from 145 to 85 kg. He is not taking any medication for his diabetes, and he's eating everything, and he's enjoying his life. So I'll show you some videos. There's another guy. His name is Salim from Karachi. Just look at his views.
ऑपरेट करते हैं। फिर मैंने तोफैल भाई से राब्ता किया, जो मोटापे का शिकार है, डॉक्टर माज साहब उनका इलाज करते हैं। तोफैल भाई से राब्ता किया और उनसे अपनी परेशानी जो मुझे थी, मैं शुगर का भी पेशेंट था, तो उनसे मैंने राब्ता किया और उन्होंने मुझे फिर जो यहाँ ऑपरेट किया मेरा। मैं एक अच्छी लाइफ जी रहा हूँ। जो पहले जितनी मुझे कॉम्प्लिकेशंस थी, जितनी मुझे परेशानी थी, जोड़ों का दर्द, घुटनों में दर्द, शुगर के लिए इतनी शुगर हाई थी कि मेरी लाइफ बहुत ज्यादा डिस्टर्ब थी। अल्हम्दुलिल्लाह अल्हम्दुलिल्लाह अभी मुझे किसी किस्म की कोई भी परेशानी नहीं है। आप सबके सामने हूँ, मैं बिल्कुल स्लिम एंड स्मार्ट हूँ और मुझे किसी किस्म की भी कोई परेशानी नहीं है। सलीम,
so these are the references, and if we have some time in the end, I'll show that video, how to perform SASI procedure. Thank you very much. And
yeah, excellent data. Wonderful. Did you notice any reflux or a patient complaining of any reflux?
I cannot hear, and आपकी आवाज थोड़ी आ रही है फारूक साहब।
मैंने कहा बहुत जबरदस्त डेटा, excellent data you have presented, mashallah, and very good results. My question is, did you notice any reflux or did any patient complain about reflux?
I've got 3 to 4 patients who complained of reflux. And it was some other way around also. Those who had reflux and it settled down after SASI procedure because we changed high pressure zone into lower pressure zone. And those who had reflux, it also settled after 6 to 8 months. But mostly people who had their reflex before surgery, it's with sleeve, it settled out when I performed SASI procedure. And the second most important thing is it is very easy to reverse SASI. You just need 10 to 15 minutes. You just go and put a stapler, that loop will come down. So there were 3 patients who achieved their target. They had well-controlled diabetes and they were losing some more weight. So I tried to give them a lot of nutritional support, but still they were unhappy. So I reversed their SASI to sleeve. And Alhamdulillah, they are doing well. But with sleeve, we can regain again because we have got one patient. I advise her not to go for SASI. She had a sleeve. And despite convincing them a lot, she went for SASI. She lost 20 to 25 kg and I had to reverse her again. It's a very interesting story because she was losing more. So most important, you should select right patient for the right procedure. And because what I have seen in patients with low BMI, if you do SASI procedure, they will behave differently. They will have a lot of nutritional problems. They will have a lot of metabolic issues. So you should select proper procedure and proper patient. And that is the topic of concern, and we'll have excellent talk regarding this topic. Dr. Asim Shabir, he is ready. I think I'll just ask him to elaborate things, and he will have a comprehensive talk about different procedures.
Thank you.
The best option.
Well done.
Dr. Asim.
Asim Shabir. Regarding whenever you are doing gastric bypass, obviously you have to be very careful regarding metabolic and nutritional problems. Long term, definitely patient can have a lot of this one nutritional issues. So you need to give them a lot of vitamins, minerals, and good food intake. That's why we need a comprehensive team to address these issues. Always should get 3 monthly and 6 monthly is vitamin levels and all trace elements. And nowadays we have got different this one supplements available in the market also in the US, and we are getting those supplements in one tablet. It has got all the vitamin and minerals. Suppose one I can quote multivitamin 45. There are a lot of others. I used to give my patient these vitamins. So you have to have a deep observation. Always have a close follow for your patient to prevent metabolic and nutritional complication when they underwent these bypass procedure. Now Dr. Asim is ready. I'll ask Dr. Asim Shabir